A patient today asked about psychotic depressions. They were wondering, if you got so depressed, so severely depressed, whether your mind could actually play tricks on you, similar to in some other psychiatric conditions like in schizophrenia or severe bipolar disorder or others. And it's a really good question. And the truth is that yes, some individuals who are in a depression, so a time where they're feeling sad, or they have decreased ability to enjoy things the way that they normally could, who also likely have a constellation of symptoms such as very low energy, low motivation, poor concentration, and more sluggish thoughts, slowed down thoughts, physically feeling more slowed down, increased self-criticism or doubt, likely poor sleep or needing excessive sleep, and others. So someone in a depression, an episode of a constellation of many of those things together, can actually get so depressed that their mind will start to play tricks on them and convince them that things are happening that may not actually be happening. Some examples of this in psychotic depressions. Depressions tend to be things like a concern that someone is actually very ill, like, for example, has cancer when there's no actual evidence that they have cancer or have ever been diagnosed with cancer. Another example of a type of psychotic delusion in depressions could be that someone may be a complete law-abiding citizen and then have the concern that the police or the FBI or the CIA are actually coming to arrest them for some crime, which in actuality they never actually committed. And so, as you can see, these kinds of thoughts would be extremely distressing for the individual. When a psychiatrist sees a patient who is so severely depressed, it is important that they're treating them with a medication that treats the underlying depression. But in these instances, sometimes they will also use an antipsychotic. So you have first-generation antipsychotics and second-generation antipsychotics called SGAs, which you may use in addition to an antidepressant to help counteract some of these negative thoughts. And then as those thoughts go away and the underlying depression resolves, some psychiatrists would actually have the patient stop that antipsychotic because it really isn't necessarily needed long-term. Because you really need a little bit of time for the antidepressant to address the root of the issue, the depression. But obviously, these kinds of situations can be extremely complex, and they really require a mental health professional to sit down with the patient, do a proper evaluation, and then to monitor very closely. If anyone out there believes that this video pertains to them in any way, it's incredibly important that they speak directly with a mental health provider at an appointment.